My name's Mark Myatt. I'm an epidemiologist. It started a few years ago that Pascale at HelpAge got in contact with me to help her analyse surveys that were in the humanitarian context where the target population was older people. Now that's very strange. Mostly in the humanitarian sector we concentrate on younger children. We concentrate on children to age of 6 and 59 months, sometimes pregnant lactating women, but never older people. And the methods she were using were adapted from child survival type surveys, which were EPI, the expanded program of immunisation, and SMART, which is the standardised monitoring tool used at present for child survival programs for malnutrition and emergencies. We talked over a period of a few surveys that were done using this method. We altered the method slowly. We tried new indicators, new ways of looking at the data, more efficient ways of looking at the data. And eventually we thought, well, we can do this cheaper. We can do this quicker and cheaper.
I was working with Mark Myatt in several surveys, nutritional surveys for older people, and also seeing that advocating for other agencies to organize surveys for older people was very, very difficult. I mean, UNICEF or UNHCR, they do regular nutritional surveys for children and pregnant and lactating women. But when we asked them if they could include older people in their target population, usually they say no, we cannot do it. The methodology would be too complicated, and we can't do it. So you know, if you don't assess the nutritional status of older people, how do you know if they are malnourished or not? So Mark mentioned that there was possibly a new method of organizing a survey that would be faster, simpler and more cost effective. So we decided to work on it with Valid International, who also has an experience in nutritional surveys, and we decided to put this project together to demonstrate that there is a method that allows agencies to perform surveys, not only providing information on the nutritional status of older people, but also other information about their health, about their social situation, about the water and sanitation in the household, about their diet and things like that. So that's what we would like to demonstrate.
It doesn't have much to say about dealing with adults, and it has nothing to say about dealing with older people. Now, what you could do is you could take that SMART design and that SMART sampling framework and then just use the instruments that we use to collect data to assess the needs in older people within that SMART framework. That's perfectly possible. My problem with that is that SMART is quite resource intensive. It costs between $5,000 and $15,000 for a survey. It takes quite a lot of time to do it, quite a lot of resources to do it. And I think that what we can do is, if we're clever, with a slightly more advanced sample design, slightly more advanced analytical techniques, we can bring the sample size down. We can bring the number of communities we have to sample down. We have to put a little bit more effort into the sampling. We have to put a little bit more computer power into the analysis of the data, but I think we can make this quicker and cheaper. We're thinking, and I hope it's borne out by the work, we're thinking that we can reduce the cost of doing this with the SMART method to to doing this with the RAM-OP method, RAM-OP would be a quarter to a third of the cost. I think that we're going to do smart survey and RAM-OP survey side by side to compare the results. Not because I think we really need to compare the results, but because there's a certain conservatism in our field that if we say, well, it works like the smart survey, it gives similar answers, it's not really out there, then people accept it. But what we really need is a tool whereby we can advocate to have programs that meet the needs of older people. Women above 45, which we generally say is the end of the childbearing period, and men above 45, nothing is done about them. We can't advocate for programming that addresses the needs of these people unless we can demonstrate the needs of these people. And I think that's what this method will do. And it will do it quickly and cheaply. And if it's done quickly and cheaply, the arguments for, oh, it's too much trouble, we've got a lot of work on our hands now assessing the children, the pregnant, lactating women, that argument is slightly damped down, is slightly weakened. Yeah? But until we have this information, people will say, oh, there's no problem. Because they confuse absence of knowledge about a problem with an absence of the problem. That older people are the repository of knowledge. Knowledge about meteorological conditions, knowledge about agricultural conditions, agricultural practices, and older ladies, grandmothers if you like, have key roles in communities, roles of matriarchs, in communities where they're influencing care-seeking behaviours, care behaviours, hygienic behaviours, feeding behaviours in the community, but in the family, the grandmother is a source of childcare, is a source of knowledge about childcare, is a source of knowledge about keeping healthy during pregnancy. And so if you really, even if you really think child survival is the thing that we need to concentrate on, child survival can be assisted, can be achieved by focusing some resources, and these are small populations. The countries we're working in are the old people are very few in number. By focusing attention, focusing some resources on that part of the population can also improve the life chances of the younger children.
When you look at when there is a food crisis or a drought somewhere in the world, it's all about children and sometimes women, always about children. So older people also, they are vulnerable to malnutrition, they get malnourished, yet there are very, very few programs addressing their nutritional needs. And they are almost never included in specific programs targeting malnutrition, though they get malnourished. We know they do, but they are not considered as a priority group because nobody knows exactly if they are malnourished or not. Well, we hope to convince the humanitarian community that RAM-OP is a sound method, that it can be performed quickly with less resources than the usual smart surveys. Then it is a very valid tool to assess older people malnutrition and other risk factors, so that they will use it, that it will be widely used in emergency situations and provide data, evidence of older people malnutrition and of the risk factor also that leads to malnutrition. And hopefully by having the data there will be more intervention targeting older people.